Welcome to Monday's edition of COVID-19. Korea has reported more than 900 infections today, a slight drop from the numbers seen this past weekend. But authorities are warning of higher figures this work week amid greater testing numbers. Elsewhere, tougher prevention measures over in the UK amid news of a highly contagious mutated strain of the coronavirus. We have more on that later on the program. First, I have our Kwon-Soa standing by with the broader pandemic coverage. So, do start us off with the latest here in Korea for this Monday.
Well, Sonia, as you mentioned, the country did drop to below 1,000 cases, which would be for the first time in 6 days. 926 is the figure we're seeing this Monday, and domestic transmissions were in the late 800s. But throughout the weekend, we have been seeing figures hovering in the 1,000s, and with that for 5 straight days, in fact, we had numbers at that level, and also the average of domestic transmissions in the past week stands in the high 900s. So with that, Korea has reached above 50,000 infections in total, and the death toll now stands close to 700, with 24 fatalities added in the past day. That is the highest daily death toll we have been seeing. And by region, we have 328 infections in the capital, Seoul. This is a slight drop from yesterday when we had a record high of 473 infections in the capital alone. This Monday, we also see 244 in Gyeonggi-do province, 88 in Incheon, also almost 50 cases in Gyeongsang-Bukdo province. Now, with over 70% of these infections concentrated in the metropolitan region, the Seoul city government, along with Gyeonggi-do province and Incheon, has been discussing even tougher measures to subdue the outbreak over Christmas and the year end. So a ban on gatherings of more than 5 people is set to take effect later this week. And this would be an even stronger measure regarding gatherings, even stronger than the level 3 social distancing measures. And the implementation of level 3 measures, however, is still on hold, as authorities say the effects of level 2.5 measures are actually beginning to show, for instance, when it comes to movement by citizens as well as spending. Now, Prime Minister Chung Se-kyun reiterated this Monday that level 3 would be the government's last option, but authorities are now concentrating on this.
First, we need extra preventive measures for nursing hospitals, nursing homes, mental health centres and ski resorts. We will also enforce measures regarding Christmas and end-of-year gatherings, parties, religious services and travel.
And the government is expected to roll out these measures for the holiday season on Tuesday.
I see. Meanwhile, on the international front, so I hear there's much concern in the UK over a mutated strain of the coronavirus.
Right, Sunny. The UK is dealing with fast-spreading infections, which is attributed to a mutation of COVID-19. And that's why tougher restrictions have been implemented not only within the UK, but also France, Germany, Italy, the Netherlands, and other European countries, as well as outside of Europe in Israel. These were fast to respond with restrictions regarding travel to and from the UK, even some implementing freight travel bans as well. Now, let's take a closer look at the figures abroad now. The UK has, in fact, surpassed 2 million cases over the weekend, with some 36,000 cases reported in the span of 24 hours. Another country that surpassed 2 million is Turkey, and India, meanwhile, now has hit the 10 million mark in total infections. And with that, the total figure around the globe stands now at 77.1 million. And those are the updates I have for now, but I'll be back again after the government briefing. Sunny?
All right, so thank you for now. Staying on the international front, we take a closer look now at the situation over in Germany, where a tough national lockdown has been imposed from last Wednesday and is poised to end on the 10th of January next year. I have Jan Rubel, a journalist at the Zeitenspiegel, live on the line. Welcome, Jan.
Hello, Sunny.
Now, I understand Chancellor Angela Merkel tested negative for COVID-19 amid a host of isolations by European leaders following French President Emmanuel Macron's positive diagnosis. Jan, please tell us more about this.
Well, she seems to be in a good shape. There are no indications that she's in bad health. You know, she's very present in public. She has a lot of appointments. Well, she seems to be very busy these days.
That is good to know, Jan. Now, Germany is struggling to contain a second wave that is reportedly fueling twice as many infections at care homes compared to the first wave back in spring. In fact, there has been a frightening number of fatalities as well as infections, Jan. How severe is the situation there? And what are the reasons behind the latest outbreak?
Well, now we have really the fastest and biggest infection rates we ever had since March when the pandemic began. And I'm not an expert, but with the beginning of the fall, the virus seems to have multiplied much faster, and we haven't reacted fast enough and hard enough. And until now, the current situation is still under control, but many hospitals are full and capacity limits will be reached soon. That's what we are afraid of.
I see. Has the government come up with efforts to deal with the potential that is shortage in hospital beds and supplies or staff members, Jan?
Yes, I mean, the supplies are there, but some people say that we slept over in summer, that we didn't get prepared as we should have been. And we started in November only with a so-called lockdown light. But that meant that the shops and the business were open, schools were open, and only now, since last Wednesday, we have a kind of hard lockdown. But it's also not a hard lockdown like we had it seen in Italy, where everything was closed. I mean, even now you can go out, you can leave your homes, the supermarkets are open.
And how is the German public responding to the latest lockdown over in Germany?
Well, the vast majority is agreeing on these steps because we see what's going on now. Now everybody knows somebody who has been infected or even be killed by the virus. That's the situation.
Jan, tell us a bit about the measures under this latest lockdown.
I mean, now schools have closed because we have also Christmas. And normally the normal shops have been closed too. Celebrations, festivities, concerts, all this is forbidden now. You can't go to museums. What you can do, you can go to the supermarket. That's it. And everybody who can work from home is allowed to do so.
I see. Jan, is there a possibility of a temporary ease in lockdown measures on Christmas Eve in Germany?
I mean, celebrations, parties are banned. The fireworks concerning New Year's Eve, they are discouraged. Until now, they are not banned, and they are only discouraged. You can also travel, but traveling is discouraged. This is the official slogan by the governments. That means you can go visit some families, you can come together with 5 up to 10 people. This is some loosening during the Christmas days, but I mean, by example, hotels are closed, restaurants are closed, and this will be complicated travel. And that's how the authorities are hoping to find a compromise between really reducing contacts and, on the other side, having these festivities, which are traditional here in Germany.
Right. I understand authorities in Germany are hoping to start their vaccination campaign within this year. What is the latest on that front, Jan?
The latest news is that the vaccination shall start on December 27th, so more or less in a week. And they're going to start with the old people over than 80 years old, and then they will vaccine medical staff, nursery staff, and then there will be certain rounds. By example, in the second round, there will be a vaccination for the people with special needs, like refugees, homeless people, people with disabilities. And in the third round, there will be, police, firefighters, and so on. And after that, the fourth, fifth round, the rest of us. So I imagine that it will take us until summer next year that everybody will be vaccinated who wants to be vaccinated.
I see. All right. Before you go, though, Jan, one short question. What is the public response to the vaccination campaign?
The public response is mixed. As I told you, the vast majority is thinking, yeah, this is the right step. But of course, we have also, maybe this is confusing you in Korea, we have manifestations until now in the streets, people who are protesting against the lockdown, against all these measures, people who try to ignore the fact that there's a virus. This is maybe, it's difficult to explain, but maybe this is a misunderstood concept of liberalism, which means it's more individualistic, or let's say egoistic, because these people don't see that doing vaccinations doesn't mean to protect yourself, but also protect the other. So vaccines are an act of solidarity. But as I told you, I would say 90%, at least 90% are agreeing on these steps now.
I see. All right, Jan, thank you very much for joining us live at this hour with your thoughts.
Thank you, Sunny.
Right, it's a little after 2 in the afternoon here in Korea, and we are poised to join the regular briefing on COVID-19 for this Monday. Now, we are starting the work week with yet another sad milestone. As I mentioned earlier, we lost 24 lives over the past 24 hours, the highest since Korea's first case of COVID-19 on the 20th of January. Now, patients aged 70 or older currently account for more than 80% of the fatalities. No one under the age of 30 has passed away from the pandemic here in Korea as of yet. We're still waiting for the briefing to commence, so let's take a quick look at the social distancing guidelines under level 2.5 here in the Metropolitan region. First, do remember that the mask is mandatory at all places outside of one's residence, regardless of the social distancing level amid the pandemic. Gatherings of more than 50 people are banned. Such gatherings include weddings and funerals, but from later this week, those in the metropolitan region may witness a tougher restriction on social gatherings. Also, 1/3 of all public servants and workers at public entities have to work from home. Still, sporting events need to take place in the absence of spectators. Meanwhile, at places of worship, in-person congregation is limited to 20 people, and online religious sermons are strongly advised, while small gatherings for choir practice, Bible study, and meal sharing are banned. In the academic arena, kindergartens, primary, middle, and high schools have closed their compounds as of last week and have adopted remote learning instead. High-risk facilities, including clubs, bars, and singing rooms, have suspended their operations, while high-risk activities such as door-to-door sales are not permitted. Cycling and horse racing tracks are closed, as are cram schools and indoor sports facilities. Public facilities such as libraries and museums need to abide by an admissions cap of 30%. Other venues such as large retail stores are allowed to open until 9 in the evening. Restaurants are allowed to accommodate in-house dining until 9 in the evening, and after that, they can only offer takeout and delivery services. Coffee shops, meanwhile, here in the metropolitan region can only do the latter, meaning takeout and delivery services. Now, banks here in the metropolitan region will open 9:30 in the morning and operate until 3:30 in the afternoon. Separately, authorities have called on hotels and other venues to cancel all end-of-year parties in light of the latest resurgence. We are still waiting for the briefing to start, so perhaps right now we can take a recap, or have a recap, that is, of the latest. No, I believe the briefing is about to start. We'll come back to you afterwards with a summary.
First of all, we have Commissioner Chung Eun-kyung with the briefing. Let us now begin our regular briefing on the COVID-19 situation here in South Korea. As of December 21st, midnight, we have 892 new local infections and 34 new imported cases. The total caseload now stands at 50,591. Currently, we have 14,738 people remaining in quarantine, while 274 people are in severe or critical conditions, and we had 24 additional fatalities. The death toll has been raised to 698. I extend my deepest condolences to the deceased and the members of the bereaved families. And we have been carrying out testings at the makeshift testing sites, and we had 94 more people testing positive, and so far we have a total of 479 people testing positive at these makeshift testing sites. And here are our major updates of our domestic infections. And in relation to a correctional facility in Seoul Songpa-gu district, we have confirmed 2 additional cases, raising the total to 217. And in relation to religious facility in Gangseogu district, we have 213 cases in total, Hospital. And also a construction site in Yongsan, we have 9 additional cases, with the total now standing at 101. And in relation to a nursing hospital in Bucheon City, we have 12 additional cases being confirmed. In total, we have 146 being confirmed to date. And in relation to a call center in Gyeonggi-do, Pyeongtaek City, we also have 10 additional cases. And also in Siheung City, we have 28 cases in relation to a nursing hospital and 24 cases at the nursing hospital in Incheon. And also in relation to a sales facility in Michuholgu district in Incheon, we also have a total of 18 people being confirmed. And in Daegu and Gyeongbuk regions, we also have cluster infections related to religious centers as well. And in Gwangju City, we also have a retail company. 13 more people have been confirmed, raising the total to 14. And we have seen reporting of the cluster infections stemming from door-to-door sales. And in Jeju City as well, we have 20 additional cases in relation to religious facilities. This is also spreading to saunas and live cafes and so forth. And we have more than 100 cases so far. And let us now look over our analysis of the risk factors for the past week. And for the past week, we have had 949 cases on a daily basis, and this is about 200 up from the previous before, and this is about 2 times higher than the previous month. And the imported cases stood at around 27.3%, 3 cases on a daily basis. And as for the regions, we have seen in the metropolitan area about 712 and 83 in Gyeongnam area, and Chungcheong area also has surpassed the threshold of a level 2 social distancing as well. And Honam, we have about 30 and about 27 in Gangwon province, and also 19 or so in the Jeju-do island. And also 72% of the total cases were clustered in the metropolitan area. And we also had the makeshift testing centers being set up at the metropolitan area, and a total of 189,000 cases have been tests have been confirmed, and we have seen the positive rate standing at about 2.5%. And we had 81 fatalities during the past week, and 49 were above the age of 80, and 19 were above the age of 70. Also, 1 in the 50s and 1 in the 40s, and a total of 95% of the fatalities were above the age of 60. And as for the sources of infections for these fatalities, most of them were stemming from the nursing hospitals. About 40 cases have been stemming from nursing hospitals, nursing homes, and so forth. And also another major portion were related to other cluster infections, and about 79 cases were reported to have the underlying illnesses. And we also have identified that most of the cases, about 40%, were related to contacts of previous confirmed cases, and about 14% were related to cluster infections, while another 9% were related to the nursing homes. And also, as for the contact with previous cases, 38% were related to their families, and 7% were related to their co-workers. And we have seen that most of these viruses were spreading through families and acquaintances as well. And we have 34 cluster infections, and most of them were religious centers, followed by hospitals and nursing homes. They were also followed by a correctional facility, construction sites, ski resorts, and so forth. And recently, we have seen many infections stemming from the gatherings with families and friends and co-workers, and most of the cases were stemming also from religious centers. So we would like to note once again that we need to curb the virus spread from the social gatherings, especially involving friends and families. So please postpone or cancel these events, and also ventilate on a regular basis, even when you are at home, and also comply with the quarantine measures as well. And if you are living with people above the age of 60, please refrain from opening your house to outside visitors, and also comply with stricter quarantine measures. And even at workspaces, please wear your face mask at all times and switch all of the meetings to non-face-to-face means. And also please note that we have seen many shared facilities within office spaces spreading the virus, so we need to take particular precautions, including ventilation and disinfection as well. And during the weekend, if you have any small gatherings planned, please refrain from going to these gatherings as well. And if anyone is suspicious of COVID-19, please make that person stay home and get tested as soon as possible. And all of the religious activities need to be switched to non-face-to-face means. And also we have seen a gathering of food and dining and meals being the major source of the virus spread within religious facilities. And also, as you know from these sources of infection, we have seen many cluster infections stemming from nursing hospitals, nursing homes, long-term care centers, as well as mental hospitals. And it is also very important to note that these cluster infections can lead to higher fatality rate and high number of people with critically ill conditions. And at these nursing hospitals and other high vulnerable places, we will be placing an administrative order to mandatorily carry out regular testings for all of the care providers, and we would like to go to enhance our quarantine measures. And starting from December, we will be intensifying our regular testings, and we will be shortening the frequency of the test for every 1 week at the metropolitan area and every 2 weeks in the non-metropolitan area. We will also carry out monitoring of these cases in these areas as well, and if needed, we will carry out swift antigen testings if anyone is showing symptoms within these intervals of the mass testings. And all of the caregivers and healthcare providers need to refrain from going to social gatherings after work, and this will be important to curb the further spread of the virus. And the head of these facilities need to designate responsible personnel in charge of the quarantine measures, and they need to supervise and oversee all of the people's conditions and symptoms as well. And if these measures are not complied with, and if they are breached, we will also have the indemnification clause for these health facilities going forward. And as for nursing hospitals, we will also make sure that we will support and provide incentives for these facilities when they are put on cohort treatment. And we will also shorten and to extend the isolation period from a week to 2 weeks, and these will also will not be subject to high payment of insurance. And also we have some updates on the influenza virus spread, and as we are seeing a very low rate of the influenza outbreak, and we do not see that the influenza is spreading majorly. And as for 1,000 outpatients, we have about 2.8 cases, which is only about 1/10 of the annual average of other times. And as for the virus, we have been collecting the samples of respiratory samples, and we have about 2 cases, which is a very low grade right now. And the quarantine authorities would like to continue to note that the COVID-19 may be exacerbated in the during the year-end holidays, and during the next 2 weeks. We also have the Christmas Christmas holiday and the New Year's holiday, and we believe that there would be many gatherings, family gatherings or religious circles gatherings as well. It is very important that we curb the further spread of the virus within this period of time by minimizing social contact, and we need to take particular precautions going forward. First, you need to cancel all of your private gatherings. You need to stay home and also switch all of the meetings and gatherings to non-face-to-face means. And second, regardless of venues and locations, you need to also wear face mask at all times if you are indoors and if you are outdoors as well when you cannot keep a healthy distance of 2 meters. And also minimize the time of taking off your masks as well. And third, if you have any respiratory symptoms or fever, please go to the screening center and get tested as soon as possible. Thank you very much.
지금부터 기자님들 질문에 답변 드리는 시간 갖겠습니다. 출입 기자.
Right, there was Commissioner Chung Kyung with Monday's afternoon briefing. So what did she have to say?
Well, first off, the assessment of the past week's COVID-19 situation and risk factors. We have 949 infections on a daily basis when it comes to domestic infections. That's the average in the past week, which is up by 287 from the week before. And that's even around double the amount we had a month ago. Also, 71% occurred in the Metropolitan region. Speaking of the Metropolitan region, since last week we had additional tests conducted at temporary screening centers, and through those 479 cases were confirmed as well. And sources of infection are traced to cluster infections especially at religious facilities and medical facilities. So that is why Tong asked for people to try to go for alternatives such as non-contact religious services and also refrain from family gatherings. And even if there is a family member within your home who is showing COVID-19-like symptoms, you should wear your mask even at home. And also we have an update on the hardline measures regarding social gatherings in the Greater Seoul area, as Seoul's acting mayor announced that gatherings of over 5 people will be banned in Seoul, Gyeonggi-do Province and Incheon beginning on December 23rd until January 3rd.
I see, that's just before Christmas Eve then.
Exactly.
All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
거리두기 3단계로의 상향 없이 현재 수준에서 확산세를 꺾을 수 있도록 조금만 더 인내하고 동참해 주실 것을 부탁드립니다.
Could increase the R by 0.4 or more, and although there's considerable uncertainty, it may be up to 70% more transmissible.
Right, the pandemic is looking to change end-of-year scenes and celebrations across the globe, with many countries striving to contain the resurgences that continue unabated by current prevention measures. I have Professor Chung Gi-seok from Hallym University. Welcome back, Professor Chung.
Hello.
And I also have Dr. Alice Hyung-Young-Dan from Ms. Medi Women's Hospital. Good to have you back, Dr. Dan.
Good afternoon.
Professor Chung, let's begin with your thoughts on the numbers of infections in recent days here in Korea.
Yeah, we had less tests yesterday, but we saw over 900 patients today. That means increased positive rate about 3.0%. Because tomorrow we'll see another big number because of increased test. then we'll see for quite a long time this kind of a number from now on. The death number is new record high, 24 per 1 day. And the reason why is mostly more than 60-year-old patients are dying from COVID-19, and the proportion of over 60s are over 30% these days. So that makes again, we'll see more death toll from now on, maybe a week or 2 weeks' time.
Right. Dr. Tan, according to authorities, mobile phone data shows a decrease in movement in the metropolitan region starting from about mid-November or late November. Now, this is positive news, and I was wondering, when are we likely to see the impact of such public trends on numbers of infections here in Korea?
Although it is good news, I'm not sure that we're going to see much of an impact. The reason why is because the clusters that we are seeing recently are those that are happening in homes, at places of work, at churches, at hospitals, and also, most significantly, in long-term residential facilities such as prisons and nursing homes. And of course, the residents there are stationary. They're not moving anywhere. For the prison, we have 217 cases recorded so far. And just over this last weekend alone, there were 350 cases attributed to nursing homes. That brings a total of 567 cases from these facilities where people are not moving around. Basically, what this means is the virus has infiltrated every corner of our country and every community unit within society. And so even without long distance travel, the virus is still going to spread. December 12th is when we saw the spike of daily cases from the 800s to the 1000s. Over the last week, we've had a little bit of a plateau of cases remaining between the 800 and 1000 range. Perhaps this is the effect of the decrease of mobility that we're seeing, this plateau. But I'm very concerned about all the gathering that's going to occur over the holiday season, all the increased social activity, the shopping that's still going on. And also, we are hearing news of a lot of underground social activity as well. What we are not being able to detect, people of gathering in clubs that are going on really undetected. And so I fear that we may see another huge spike in cases in the near future.
I see. Professor Chung, there has also been an alarming rise in the number of critically ill patients amid this latest outbreak. What are your thoughts on this?
Yes, critically ill patients are increasing in a tremendous way. So I'm quite worrying about that. Having said the number of, the proportion of aged elderly people are increased already, about more than 30%. We'll see more severe and very severe cases again for coming weeks. Maybe the fertility rate will be not very high because we have a fertility rate of 1.38 so far, which is quite low, lower than that of other countries and lower than the first pandemic which occurred in Daegu and Gyeongbuk area. The reason why the case fertility is low is because we have a larger number of confirmed cases. I don't think the severity of COVID-19 has decreased or increased, but since we are seeing a more number of confirmed cases, we can see a bit lower percentage of case fertility rate. But again, we'll see quite many number of deaths every day for the time being.
I see. Dr. Tan, according to the Global Health Body, a nation can ease its COVID-19 restrictions if its test positivity rate is below 5% for at least 2 weeks, it says. Now, Korea's test positivity rate has been steady below 5%. What does this tell us about the outbreak here? keeping in mind that figure?
Right. Well, as you said, test positivity has been less than 5% pretty consistently. Yesterday, the test positivity was 2.9% for directed testing. For unsolicited community testing, that positivity rate was even lower. It was 0.25%. So if you compare just those numbers, we are doing better than other countries around the world. However, as I've said before, we can't take these numbers just in isolation. They must be interpreted in the context of our healthcare availability and our epidemiological survey capacity. And both have been overwhelmed. And so if you look at it from that context, we're actually not in a very good position. And our situation is more similar to places, say, like LA County in the United States, where they are struggling with bed shortages similar to what we are experiencing right now, and their positivity rate is 14.7% over the last 7 days. So yes, the numbers in terms of positivity have been relatively good, but as I said, we are experiencing bed shortages and fatalities that are, in my opinion, unacceptable.
Professor Zhang, elsewhere around the world, Germany, as we mentioned earlier on in the program, has opted for a complete lockdown to deal with its latest resurgence. What are your thoughts on such tough efforts to contain the virus?
I think it works, because even though the Germany has shown the 10% of positive rate, if they didn't perform a lockdown, they could see more than 10%, like 20%, 30%, because the virus lives in our body. And if virus comes out of our body, it cannot live longer. So if you have a containment in each person and the person doesn't move, then the virus will disappear, or someone can get a disease, but then they can be treated. So a certain period of lockdown works, and for some extent and for some time. But once you ease the lockdown, then the virus will proliferate again.
I see. Dr. Tan, following news of a mutated strain over in the UK, we've heard of a similar piece of news from South Africa this past weekend. What is known about these new mutations so far?
Right, so the mutation has been found, as you said, in the UK, in South Africa, also in Australia, the Netherlands, Denmark, and Belgium. In the UK, it's been noted to have 70% more transmissibility. In South Africa, it's been noted to cause more severe cases among young people. Although the mutation itself, it's the N501Y mutation, which is occurring in the spike protein. Even though it's the same mutation in those different countries, it does seem to have originated from different sources, and it seems to be behaving differently in these different regions. What we know so far is that it was first detected in September, and it has since spread rapidly in the UK and in South Africa. Australia has been able to manage the spread, and it's contained it completely. In terms of implications, there are a number of serious implications in terms of whether the strain will be able to be controlled with the vaccines that are now available, whether or not our treatments, the antibody treatments, will work against this. In terms of natural immunity, will people who had COVID-19 one time, will they be vulnerable to another set of infections with this new strain? And so the global community, we need to be very vigilant about monitoring all cases of reinfection, all cases of failure of treatment and vaccine, and then also monitoring the severe cases to see if perhaps there's a correlation.
Right. And staying with that, Professor Zhang, what impact does news of such mutations have on the vaccination campaigns that are underway right now in the UK, the US, and Canada?
Yeah, Dr. Tan mentioned the spike protein. The spike protein is the only armament of a COVID-19 virus. If the virus can change the spike protein, the component, which is from a genetic variation, then the virus can detour the vaccine. So the spike protein binds with the ACE2 receptor in our body, in our cells, and the cells are spread all over the body. So the vaccine make antibody to a spike protein, and when the spike protein varies significantly, then the vaccine cannot prevent the virus from our body. So that's a big disaster. From the beginning, we anticipated the variation of single RNA virus because RNA virus copies a lot, and sometimes it varies. It makes a mutation as a regular base. So we'll see. We have to see. We have to see whether the spike protein varies a lot or not.
I see. So I'm sure studies are underway. Dr. Dan, back here in Korea, to address the shortages in beds that you mentioned earlier on, the government has ordered major general hospitals as well as university hospitals to allocate a portion of their beds, at least about 1%, for critically ill COVID-19 patients. What are your thoughts on this mandate?
Well, you know, most ICU beds in hospitals here in Korea are in open wards. In other words, the beds are only separated by a curtain. And this type of configuration is not safe when we're dealing with a highly infectious disease such as COVID-19. The alternative is to have a single room, negative pressure room, dedicated just to that one COVID-19 patient. But these types of beds are very scarce in our country. And also we need to consider all of the common use equipment such as portable x-ray machines. There would need to be dedicated personnel just for the COVID-19 patients to prevent what we call nosocomial or hospital-based spread of the infection. My concern is if we continue our current trend of seeing more than 300 cases per day who are aged 60 years or older, we will run out of ICU beds even at these private hospitals. We will run out in a matter of days. And so it's not, you know, that's one arm of the plan, is to get more hospital bed capacity. But the other, perhaps more important arm, is to prevent new cases from occurring. And that's where social distancing and heightening the alert level, going up to perhaps level 3, that's where those kinds of measures will help. And we can't just think that the problem will be solved by getting more beds.
Right. And meanwhile, Professor Chung, instead of raising the country's social distancing level to a 3, the government has instead revealed intentions to further toughen, that is, restrictions on venues that trigger cluster infections. Now, these venues would include board game cafes. And what other places or blind spots are they that the authorities can focus on to deal with the latest contagion?
Yeah, I'm thinking about the very small gatherings in a very small closed space. People say that in level 3, the large department store, large malls, and movie theaters should be closed. I don't think it's a big deal because there are not many cases occurred confirmed in those places. I'm more concerned about the small places, small gatherings without masks in a closed space, without any ventilation for a long time, like small restaurants, bars, and even the family gatherings or at-home gatherings, more than 10 people. They can communicate each other, the infected cases. So if you like to restrict more, rather going for restricting large stores like that, but rather focus on small gatherings and small shops and etc. That will work, and that will also cannot stop the economy, whole economy in this country.
I see. And perhaps in response to Professor Chong's concerns, the government today announced plans to restrict social gatherings of more than 5 people starting from the 23rd. Or, I'm sorry, that would be the Seoul city officials have decided to restrict gatherings of more than 5 people, social gatherings we're talking about. What are your thoughts on this, Dr. Dan?
I think that will help. I think this is what we call the plus alpha, right? It's the 2.5 plus alpha. The government is just very reluctant to go up to level 3. But you know, our level 3 measures are a soft lockdown. They're not a hard lockdown compared to what other countries have done. So I'm sure that they will help, but I think what needs to happen is just a mindset needs to really settle in to every individual in our country that we need to put safety as our first priority. And any time we venture outside of the house, we need to ask, is it worth it? Is it essential? Is there an alternative to going out in person? And making safety the priority, I think, will change everyone's decision-making process. And that's what we need to do. People need to take personal responsibility, because even if it feels, and that's the thing about this virus, even if it feels like I'm safe, my family's safe, my friends are safe, that's what gives people the sense that it's okay to go out
that
to the
false
restaurant.
sense of security.
And we need to overcome that.
Right. All right, Dr. Tan, as always, thank you for your thoughts. And Professor Chung, thank you for being with us today. Right, that brings us to the end of Monday's edition of COVID-19. Now, authorities claim the essence of social distancing depends greatly on its implementation by members of the public. So do seek to abide by the current prevention measures. Thank you for watching.